Good morning. In 2005, we received, after 2 years of research, a substantial grant from two foundations to develop a program, and the program that was developed was the Women Moving Forward program. And the program, during those 5 years, you can imagine it's wonderful to have the funding to establish a program. We did intense evaluation, research. We also did a manual and a toolbox. And the program won awards, and we were very pleased. But unfortunately, after 2010, the funding from those two places had ended, and we've been very fortunate to, since that time, always come up with enough money to run 2 intakes a year, up until this year. So one intake is done in September, where we usually take in 15 women, and there's always a dropout. And in January, the intake is much lower. It's approximately 10 women with a few dropouts from there as well. We've been challenged by the funders that our numbers are low and that the program is expensive. But we take in women between the ages of 20 to 29 years old who are on social assistance, who have mental health problems, who have been victims of abuse, whether it's growing up abuse or whether it's from their boyfriend. We've had women in our program with addiction issues. And they may be looking for somebody to love them. So it's a challenging group of women. But what's so wonderful about that is that we have seen remarkable results. So we're still committed to finding that funding for the program. So when we knew, we really believed that this program impacts health, well-being, and parenting on their children. We've always been fascinated with, as we see women go through this program and go from low self-esteem to going off to college or university within a year, it impacts their children. We hear the women's story of saying, I do homework with my children now. Before, I never did homework. I never watched my kids do their homework. They read with their children. They've learned to read and appreciate reading. So those are all really valuable things in the program. So and of course I knew Beryl from a committee we sit on in Jane Finch. Jane Finch has a wonderful relationship with York University. And, you know, one of the things that happens in the real world is that you go after funding, you have to show that you are doing results. Hence, the opportunity came up to do a research project with Beryl. But some of the challenges were really interesting. And those challenges were in the number of women that come into the program. We have dropouts. And some of those women that were interviewed at the beginning may not be in the program at the end when they're to be interviewed. Unfortunately, around about the time shortly after the project started, the manager who had been there holding the fort together, and again, we had to reduce, when we lost the funding, we had to reduce the manager time and staff time. So we were operating on a shoestring budget. Manager left, and where's the continuity? That created some challenges there. And again, operating on a shoestring budget does not make it easy. But one of the things that we found in working with York from a community perspective is the adaptability. Yes, the program's going on. We've been doing it. She interviews the women, and we keep things going with the women. But the flexibility is really, really important, and the adaptability of how the researcher comes in. And that raises another issue of concern, is making sure that the researcher that comes from the institution is the right researcher for this particular group of women. And I think that you're not always in control of who your researchers are, but that connection has to be there for the women to respond in the way that trust is a big issue for young women. And so you need to make sure that that was an issue for a while, and it became an issue in the project and something that needs to be dealt with. But I think that coming from a community perspective, you really need to make sure that the project that you work in, the researcher has to be flexible, the staff have to be flexible, the women have to be flexible. It can't be a research project comes in, do your work, and leave our community. And in Jane Finch, we've always said that with any of the professors we work with in our community, how people respond to academic people from a community perspective and also from a cultural perspective. We have women in the program, probably 95% of the women are from the Afro-Caribbean community, some from the Hispanic community. And again, research may not be common to them. The kind of questions that you're asking or needing to ask are not always common with the women. So I've really appreciated the fact that that the university, and Beryl in particular, has been very adaptable and flexible with this research. Currently, we just completed a feasibility study to look at what the future of the organization is going in, or in the program is going. And again, Beryl has rolled with the punches all the way along, so we've appreciated that. So I'm going to pass it to you.
Thank you, Wanda. So Wanda's given you the sort of the broad strokes overview of how the project came to be and what the objectives were. So she said we met in a community-based committee where the focus of the committee is knowledge exchange between the university and community partners. So she had a need for a researcher, and I thought the project sounded interesting. And I thought, I can be a researcher. So I stepped up. One of the first challenges was funding the project. I happened to be going on sabbatical that year, and my sabbatical started in July, and I was fortunate to get a sabbatical leave fellowship, which wasn't even for this project, but something happened in my personal circumstances where the original project didn't work out, and then I thought, well, this project would be great for my sabbatical leave project, and the plan was to complete it in 1 year. So as they say, great laid plans of mice and men. I thought it was going to be, we were going to go in, have 2 intakes, one in September and one in January. We were going to get our entire sample, do our data analysis, neatly wrap it up at the end of the year, and move on with our lives. That plan didn't work because many things intervened that we didn't anticipate. And we needed to, as Wanda has said, we needed to adjust to the challenges and find ways to overcome them. So at the very beginning, we thought we were going to do a total of, we had 3 time points for data collection. At the beginning of their entry into the program, at the end of the program, so a match pair, and then an independent third sample of a program alumni who had completed the program within 3 years. And we wanted to do 30 questionnaires and 10 in-depth interviews with hopefully the same individuals. So if they had an interview and a questionnaire at T1, again at T2, so that we could match the findings from one time to the other and hopefully be able to demonstrate some kind of impact on the individuals that had a benefit to them in terms of their health and well-being and parenting. So at the very beginning, we didn't do too badly in recruitment, but the issue was with retention because some of the women that had entered the program and agreed to participate withdrew for various reasons from the program, so they weren't retained in the sample. So we needed to extend. First of all, we didn't get the numbers that we thought we were going to get. We thought for sure we'd get 15 in September and probably close to that in January. We didn't get near that, so we extended the data gathering for 1 full year. And even at that, we ended up with only getting close to 10 at each interval with interviews, but not quite. And then of the time 2, where we really wanted to match individuals from time 1 to time 2, only 5 of the time 2 individuals had actually participated in a time 1 interview. So we had to get some individuals that hadn't participated earlier to make up our sample of close to 10 at time 2. With the questionnaires, we didn't even do as well as that. We had a total of 29 out of our targeted 30 at time 1. At time 2, we only had 17 because of the attrition factor. Not attrition from the research, but attrition from the program. And at time 3, we had 25, which wasn't too bad, almost our 30. Even for those that withdrew, we had hoped that we would be able to follow up with them and at least find out what circumstances led to their withdrawals. We thought that that would also be interesting information, but it was very, very difficult to make contact with those women and to actually find them once they had withdrawn from the program. As one has said, they had quite a bit of turnover of their staff with the program. So that was a little bit of a challenge. Well, it was a challenge for us in that we were dealing with different individuals. The constant turnover, it seemed to us as quite constant turnover of staff that we were contacting. And then the staff, it seemed to me from sitting where I was up at the university, didn't seem to really appreciate what the program or the research was for. They seemed to feel that, in my sense, was that it was university-driven research, where in fact we were almost like contracted to do the research to support the value of the program, and we were trying to provide a benefit to the program. But it seemed like we weren't getting that sense from the staff that they really felt a commitment to the research at times. in hindsight, looking back from where I am today, I think I know the reason for that, in that the individual that I had contracted to do the research maybe wasn't the best fit. And unfortunately, it didn't really, we both felt too kind to be able to speak up about it. And in hindsight, I wish perhaps we'd chosen a different individual, but we did have 2 individuals that were gathering data, and the second person was outstanding. So that was just one of the things that hadn't been foreseen, but in the end, we'd got our data. It's good data. We're going to make something out of it, and I think it's going to substantiate the value of the program.